720. I do want to go to Cassandra Host. She is an emergency department spokesperson for the Australian Medical Association here in WA. Dr. Host, good morning.
Good morning.
What's a typical day like for a doctor or a nurse in an ED and the pressures that they face?
Oh, it's a tough time to be working in EDs at the moment. The staff are doing the best they can to care for the communities they serve, but it's overwhelming. Being faced when you're coming to work to see those patients and people sitting waiting with their prolonged wait times is very frustrating for both staff and the patients as well. And then also, within the ED, because we have hospital access block, which means the hospitals are full. So there's many patients that should be up in a ward being cared for in the hospital that are sitting in ED, needing ongoing care in ED, which, contributes to the problem of stopping those from the outside in the waiting room getting in. So it's a really tough time for staff and patients too.
So if we look at the policies that were presented yesterday, two very different approaches. So first, if we look at the ALP, it says it will upgrade the emergency department at Royal Perth with 50 more bays, a dedicated mental health unit. What is your view of that approach?
Oh, I think, for Royal Perth, Royal Perth Emergency Department upgrade is long overdue. It's, still got one of the sort of older footprints of an ED that's been there for obviously a long time. And an upgrade to that is fantastic. I think it'll, as far as, big effects on ramping and things, maybe for a short amount of time it will have an effect at Royal Perth Hospital, which is great for those patients in that catchment area. But obviously for everyone else, everywhere else across the state, it will have no impact. But still, any emergency department upgrade or hospital upgrade is always welcomed.
And it also, ALP is also saying it would spend $7 million on a blueprint for broader works on the wider hospital. What else does Royal Perth need?
Royal Perth, as I said, Royal Perth needs a major upgrade, and upgrades to services, I think, across, both blocks, thinking of the services we need to provide for the community for the future. I know, it's, again, a lot of those buildings have been there for a long time and it needs a whole sort of overhaul to make it sort of fit for purpose going forward for our communities.
I'm talking to Dr. Cassandra Host. She's the emergency medicine spokesperson for the Australian Medical Association here in WA. And I want to do a bit more of this during the election campaign, just testing the policies. And I guess it's timely that both Liberal and Labor yesterday were announcing how they'll try and ease the congestion in emergency departments. And then if we look at the Liberals, they're very much about diverting non-urgent patients away. And they're saying they will pay for non-urgent patients who present in an ED to go to St John urgent care clinics. Is that a good idea?
The patients that are seen by urgent care are often different patients seen by the patients seen by emergency departments. I think it's important to remember too that patients that call an ambulance often, they need that ambulance to transport them to a hospital, and then beyond that, most of those patients, a large number of those patients end up needing admission in hospital. And a lot of them certainly need that hospital level care. Again, so then, the impact on emergency departments for that will be probably very, very minimal. It's not the patients that, can walk in and see the GP, as would be with urgent care, that take up a lot of time to be seen in an emergency department, and they're not the ones that are really involved heavily in that access block.
And then you've got the issue of ambulances, because Libby Medin was saying in some cases it would be ambulances then taking those patients to these urgent care clinics. And I just wonder if they can manage that, like another trip.
I'm not across the details of how that would work. One would assume that instead of going to a hospital, they're going to an urgent care centre, but one would hope that those ambulances are then able to hand over the care of those patients very quickly like they can in a hospital, and then we don't end up with sort of another area of ramping where we have ramping in a hospital and ramping at urgent care as well.
Do we need more urgent care clinics?
I think any service that allows patients to be seen in a timely manner is good, but it's got to be the right service for the right patient, so the patients can access the right care at the right time. Otherwise, it's a duplication, and it's a waste of both the patient's time and obviously the money that it's taken to do that.
So what I'm getting from you, Dr. Host, is that you need more beds within the system, beyond the ED. That's your pressure point.
Yeah, that's absolutely correct. So the way to remove access block would be actually to have more hospital beds and more appropriate pathways for patient care. So you've got the right patient getting the right service at the right time to get the right care. And that's the best for the patient, best for the community, and also best for the taxpayer dollar as well.
And the other big problem is that we know every day there are people at the ED that probably should not be there, but it's free and they can go straight away.
Yes, that can happen sometimes, but it's not a majority of cases, and those certainly aren't the patients that are contributing to access block. We do know, though, that it's really important for the community to have a GP or a GP practice that they associate with so they can get care with their GPs. So GPs are the best people to look after you in the community long term, because they get to know you and know your circumstances and your health problems, and also then to manage them the best and prevent new ones happening in the future.
All right, I'll leave it there. Thank you so much for talking to me. Dr. Cassandra Host there, she is an emergency doctor, and she's the AMAWA's emergency medicine spokesperson. Now remember, there are two types of urgent care clinics. The St John's one that I was talking about now, they are not free. And as part of Libby Metham's policy yesterday, she's saying that they would pay for those patients that end up at an ED that can go to St John's. They would provide that free of charge. Normally you've got to pay, right? And it's not cheap. It's over $100. So that's that. So I think she was talking about 60,000 appointments, if you like, under this policy. Then you've got the Medicare ones. They're run federally. They are free. So there is a big difference. So when you talk about urgent care clinics, you need to know that there are two different ones. And I know that a lot of people get confused, and then they turn up at St John's and go, what do you mean you're charging me? I thought it was free. So it's good to remember that. 1300 222 720.